highlights the key considerations to help keep colleagues safe whilst managing a cardiac arrest during the coronavirus pandemic. It is intended to supplement clinical guidance. RRV response. This paramedic has been dispatched on an RRV to a possible cardiac arrest where the patient has collapsed during a 999 call. The paramedic arrives on scene 2 minutes after the patient collapsed. On arrival at the address, remove basic equipment from the boot of the RRV. As the first responder, you need to don Level 2 PPE, as this abbreviated demonstration shows. It is important to complete this from hands to head to hands. Hand hygiene, apron, face mask, eye protection, gloves. As you can see here, the paramedic tries to minimise cross-infection by not using his hands to close the RRV door. You can see the paramedic leaves the response kit away from the patient to minimise the risk of contamination, including removing the radio from its pouch and leaving it in the kit dump area.
Danger. The scene looks relatively safe, so I'm going to approach. There's one patient on the floor, so I'll approach with caution. Hello, my name's Josh, I'm one of the paramedics. Can you open your eyes for me, please? Hello, can you open your eyes for me?
Note that when checking for breathing, the paramedic does not place their face near to the patient's mouth to feel or listen for breathing.
3019, thank you. Can I get a P1 backup for confirmed cardiac arrest? And can the crew come in level 3 PPE, please?
The next task is to apply a surgical mask to the patient and commence basic life support with application of the AED alongside compression-only CPR. Note that a surgical mask has been placed in the AED case in advance. On arrival, the DCA crew need to work together to don Level 3 PPE to enable them to perform aerosol generating procedures. In this clip, the DCA crew are donning Level 3 PPE simultaneously whilst referring back to the JailCalc Plus app for guidance. They are checking each other's PPE to ensure it has been correctly donned. Names and roles are written onto the suit to aid identification.
Need to start our bag for that. Alright, what do you want, Roisin? Sheen and I'll just put Para? Yeah.
The DCA crew collect the required equipment and proceed to scene. On arrival, they add their equipment to the kit dump and enter the hot zone.
My name's Rachel and this is Joe.
Hi guys, my name's Josh. This is Ben. Because I've made a phone call to 999 and collapsed on the phone. I've arrived 2 minutes after the call. If we could swap, we've got a rhythm check in 10 seconds.
Okay,
and I can swap with you.
Alright, Josh, I think once we're at our next rhythm check, we're going to move him down. Whilst Joe gets some airway stuff. Are you happy with that?
Yeah, that's okay. On move. Ready, set, move.
I'm going to start CPR. You can go and put your PPE. And Joe, can you sort the airway for me?
Yeah.
The DCA crew are now in a position to undertake AGPs, including securing an airway and commencing ventilations. The RRV paramedic returns to their vehicle to collect and don Level 3 PPE. DCA first on scene. If a DCA is the first resource on scene, the attendant's role reflects that of the RRV first responder. If possible, the clinician should be the attendant to enable an evaluation of the viability of resuscitation. If safe to do so without removing the seatbelt, the attendant can don Level 2 PPE en route to a potential cardiac arrest incident so they can reach the patient quickly. The attendant ensures the kit dump is started.
Hello, Reaching. Can you open your eyes for me? Can you hear me?
Primary survey is completed and viability of resuscitation evaluated. In this instance, it is deemed viable. A surgical mask is applied to the patient and then the AED is attached.
Hi Regine. Right, the kit dump's been ready.
This
Okay.
this arrest is viable, so you're going to do 32 and I'm going to
Yeah.
go and change my PPE.
Yep.
To provide 32 CPR, the driver brings in the necessary equipment before taking over from the attendant.
Okay.
3, 2, 1.
Scene management. With 3 responders on scene, it is preferable for one to undertake the role for providing equipment, liaising with bystanders, communicating with the clinical hub, and utilising the cardiac arrest checklist.
Could you put up iGel and ETCO2 for me, please?
Yep.
Control, this is 3260. We have a viable cardiac arrest and we require resources en route to this calibre.
If an AED is not already at the scene and it is safe and feasible to do so, provide the AED to a bystander and ask them to open it and follow the instructions whilst you don your PPE.
This one, if you could pop that on the patient and follow the instructions, I'll be with you in just 2 seconds, okay?
We understand that managing a cardiac arrest during COVID-19 is a real challenge, so we've ensured we have set up an advice line to offer you support on decision making and running an arrest during these times, so don't hesitate to use that service. Don't forget, there's plenty of support out there to assist you with guidance should you be affected by any incident. That can be accessed through a range of people, including peer supporters, the Staying Well service, learning development colleagues, your clinical leads, or the operations team.
This video has been produced to help support your clinical decision making. Thank you. Stay safe.